The July 26, 2022 meeting of the Human Services Committee will now come to order. Will the clerk please read the roll?
Mr. Blankley. Mr. Blankley is present. Mr. Brew. Mr. Brew is present. Ms. Delvecchio Hoffman. Delvecchio Hoffman is present. Mr. Dondorfer. Mr. Dondorfer is present. Ms. Hasman. Ms. Hasman is present. Mr. Keller. Mr. Keller is present. Chairman Milne.
Here.
Chairman Milne is present. Ms. Smith. Ms. Smith is present. And Mr. Udelson. Mr. Udelson is present.
And is there anyone signed up for the public forum?
There is not.
And is there anyone present who has not signed up to speak but who would like to address the committee at this time? Seeing and hearing none. Next item on the agenda is the approval of minutes. You have the June 29, 2022 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. New business. Next item on the agenda is new business. Mr. Clerk.
Referral 22-0230, amend Resolution 314 of 2017 as amended by Resolution 244 of 2020 and Resolution 48 of 2021 to accept additional funding from the New York State Department of Health and extend the time period for the nutrition programs.
A motion by Legislator Brew, seconded by Legislator Smith. Is there any discussion? Legislator Brew?
Administration, what would be the mechanism to let people become aware of the program?
Through the chair, the WIC program is a referral program, and the local pediatricians and a lot of community agencies are aware of it, and they refer people to the program. And in addition, there's a couple of staff members who do outreach for the WIC program, who go to provider offices and to clinics, who provide education, and also go to, for example, the baby cafes to talk about the WIC program and encourage referrals.
Thank you.
Are there any other questions or comments? Seeing none, all those in favor signify by saying aye. Aye. And opposed, the same? Seeing none?
Referral 22-0231, amend Resolution 352 of 2021 to accept additional funding from the New York State Department of Health and extend the time period for support of the Monroe County Nurse Family Partnership Program.
A motion by Legislator Smith, seconded by Legislator Dondorfer. Are there any comments on this? Hearing none, all those in favor, please signify by saying aye. Aye. And opposed, the same. Approved.
Referral 22-0232, amend Resolution 521 of 2021 to amend and increase the contract with Nurse Family Partnership for support of the Nurse Family Partnership Program.
The motion by Legislator Dondorfer, seconded by Legislator Keller. Are there any discussions on this? Hearing and seeing none, all those in favor, please signify by saying aye. Aye. And opposed, the same.
Referral 22-0233, acceptance of a grant from the New York State Department of Health for the Rabies Reimbursement Program.
A motion by Legislator Keller, seconded by Legislator Brew. Are there any questions or comments on this? Legislator Keller, you have the floor.
Through you, Mr. Chairman. Some idea as to the utilization.
Through the chair, the rabies reimbursement is used for post-exposure rabies treatment mostly through a contract with the Wilson Center, where we send cases that have been deemed exposed to a possible rabid animal. We also use this funding for rabies vaccine clinics for dogs, cats, and ferrets. We purchase rabies vaccine And we also do specimen prep. So we will test animals as well, where we then send the animal for testing at Wadsworth to determine if the animal itself is rabid before we send somebody for treatment. The amount of humans treated last year was 148. The number of animals vaccinated last year was 2210. We investigated 1,746 exposures, and we sent 115 samples to Wadsworth.
Legislator Keller, are you good?
I'm good, thank you.
Any other questions or comments? Hearing none, all those in favor of moving this forward, please signify by saying aye. Aye. And opposed, the same? Approved.
Referral 22-0234, authorize a contract with Patagonia Health to provide public health communicable disease data management system replacement and implementation support services for the Monroe County Department of Public Health.
That's moved by Legislator Brew, seconded by Legislator Smith. Are there any questions or Legislator Blankley?
RFP process, and that that Patagonia was the one determined to have the best qualifications. I'm just wondering if the administration can fill us in on what those qualifications were.
Through the chair, we had several characteristics we were scoring the respondents. I think one of the most important one was, does the vendor have experience with New York State public health law and with the information system requirements? So that was a key scoring. Other characteristics include their ability to meet the needs. If you wish, I could go through all of the scoring criteria.
No, thank you. That's sufficient. I appreciate the focus on being able to work with local health departments and the State Department of Health as a criteria. Thank you.
Legislator Brew.
To the chair, to the administration, who were the other bidders as a result of this issued RFP, and were any of them local?
Through the chair, the other ones that were not selected was Cure MD, Medicalistics, NetSmart, and NextGen. None of them are local vendors. Some were from as far away as Texas. Probably the further you got from the East Coast, the less understanding of what New York State requires was known.
Thank you.
And are there any other questions or comments on this? Hearing and seeing none, all those in favor, please signify by saying aye. Aye. And opposed, the same?
Referral 22-0235, acceptance of funding from the New York State Office of Children and Family Services for youth sports and education opportunity funding.
I have a motion by Legislator Smith, seconded by Legislator Dondorf. Are there any questions or comments on this? Legislator Udelson.
Providing the services. I know that it's nonprofits, but how will this actually work as far
Through you, Mr. Chairman, the programs will be going out for RFP, so we'll have a selection opportunity to look at the proposals once we put the RFP out.
build on that. Just my understanding, these are programs that will be offered by some not-for-profit recreation programming.
Correct, through the chair. So the development of the funding came through New York State through the legalized mobile sports wagering that occurred in 2021. Monroe County was issued $32,725. The fund was created under the Office of Children and Family Services, pretty much for the purpose of providing annual awards to sports programs for underserved children, youth through the ages of 6 to 17. They're going to be grants, and then they're going to be utilized to support youth development, as you said correctly, through local not-for-profit organizations that are focused on sports.
Is there any other questions or comments? Hearing none, all those in favor, please signify by saying aye. Aye. Any opposed, the same.
Referral 22-0241, acceptance of a grant from the New York State Office of Children and Family Services for the Family First Mobile Response Program.
I have a motion by legislator Dondorfer, seconded by legislator Keller. Are there questions or comments on this? Legislator Brew?
Thank you, Mr. Chairman. To the Chair of the Administration, could the administration just provide just a brief description of how this program works? Curious.
Through you, Mr. Chair. Yes, Monroe County was blessed to contract with New York State Office of Children and Family Services. What it provided was a $250,000 grant. New York State Office of Children and Family Services, on behalf of Monroe County, purchased what we call a Winnebago. I think that's the right terminology for it. Wonderful vehicle that we're going to be utilizing for a few things. First, we're going to be utilizing it for what we call a mobile stabilization unit, more from the lens of prevention, specifically for our child welfare cases, where we'll have an opportunity to kind of work with families, foster parents, and youth to ensure that we have the right placements, ensure that they're getting the right services, more in a preventive, not in a crisis model. When we're not utilizing the vehicle, we're going to take it on the road. We've been identifying through our data what we're calling maybe some service deserts. So for example, we have a high concentration of what we call SNAP recipients that are getting food supplements, but our offices are on St. Paul and Westfall Road. So we want to utilize that for mobile services, for attending community events and providing resources and services in more of a mobile fashion.
Okay, thank you for the explanation.
Any other questions or comments? Seeing none, all those in favor, please signify by saying aye. Aye. And opposed, the same? See none.
Referral 22-0242, authorize an appropriation transfer and intermunicipal agreements with the City of Rochester and all towns and villages within Monroe County for continuing COVID-19 mitigation and response actions.
Have a motion by legislator Keller, seconded by legislator Brew. Are there any discussions or questions on this item? Legislator Keller?
Thank you. Through you, Mr. Chairman, to the administration. And I understand you're likely going to have to provide this later, but can you provide a list of the recipients of the monies from these IMAs to Rochester and to the various communities, and also the criteria whereby those amounts were determined? Is it by population, a per capita allotment, or some historical case count numbers or something to that effect? Thank you. And I yield the floor.
Mr. Chairman, I will respond. This is ordinarily that's a appropriate question. Tonight, I'm going to say that this is a forward-looking referral. We have not discussed with any of the local municipalities the scope or cost of an IMA. I say this is forward-looking because Monroe County executed IMAs with municipalities under our CARES Act funding in 2020 and 21. And the services they provided seemed pretty valuable when it came to community-wide distribution of PPE and other direct pandemic response and mitigation initiatives. So we just wanted to have that ability up front and let you know that this was going to be an option we'd like to keep in our back pocket should the need arise over the next several years.
Okay, thank you. If I could just ask one more then,
Yes,
Mr.
sir.
Chairman. Okay, no, I very much appreciate that and pre-positioning, if you will, resources to the agencies best suited to deal with issues in the future. The amount then, was that determined based on known historical spend in previous years?
Mr. Chairman, not going to lie, $20 million is a best guess. I will say that when under the CARES Act funding in 2020 and 21, Monroe County spent $20 million on mitigation efforts and between 30 and 35 million on our vaccination and testing pods. I think this 20 million, at least in my mind, was intended to focus going forward on our vaccination and testing pods. With the new BA2 variant rapidly spreading across our country, it may not be as medically hazardous. I don't know what the right phrase is, but it does have a very high level of transmission. And there's already discussions at the state and local levels of whether another vaccination pod should be stood up. You know, the height of the pandemic over the first 2 years, I mentioned 20 and 30, so that's $50 million. You know, a lot of people don't think going forward the variants are going to be as medically risky. So this really is just to position ourselves to be able to fund immediately upon the need vaccination and testing sites. In doing this now, Mr. Chairman, you know, it gives us pretty much the rest of the current calendar year to continue to assess the pandemic situation, and if need be, right-size this dollar amount request before the county gets into issuing contracts as a result of the RFP for services we've put on the street and due back at the end of the month.
Yeah, okay, thank you. And I do appreciate the proactive preparation and appropriate positioning, as I said, of resources to respond with any future emergencies. So thank you. I yield the floor.
And are there any other questions or comments on this item? Seeing none. All those in favor, please signify by saying aye. And opposed, the same? Carried.
Referral 22-0243, amend Resolution 250 of 2021 as amended by Resolution 414 of 2021 to extend the time period for the 2021 Safe Summer Youth Engagement Program and authorize contracts.
A motion by Legislator Brew, seconded by Legislator Smith. Are there any questions on this item? Legislator Smith?
Is this?
Yes, through you, Mr. Chairman, this specific gun violence funding that we received was allocated through the Office of Children and Family Services for specific zip codes within the city of Rochester. Through the chair, 3 organizations were selected. The first organization was Teen Empowerment. They did a contract with Gandhi Institute. The second organization was an organization by the name of A&W Foundation. And then the third organization was the Facts Youth Program.
And through the chair to the administration, are we currently looking for a new youth director?
Through you, Mr. Chair, rapidly, yes. We are, and the posting just closed, so we're just reviewing applications right now.
And through the chair, I have one more question to the administration. I did see on the referral that this extension was asked a week before the referrals were submitted. Is there a reason why that timeline?
To you, Mr. Chair, this is a tricky one, right? When we got the funding originally from the Office of Children and Family Services, there was a really quick turnaround time. Statewide, myself as a commissioner, other commissioners went back to the state and said, at this point, it was really hard, right? One of the main tenets of this program is that they wanted grassroots organizations for specific zip codes. We had to do some work, we had to do some engagement. The other piece to that was the fact that they want us to do some youth engagement. So we had to hold focus groups, listening sessions, kind of to ascertain what the programming would look like. Fast forward, we had to get contracts in place and things executed, short turnaround time. Went for another extension. The state gave us additional funding and extensions up until March. This is probably like the third extension throughout the state. So what we're asking for is just to extend it out. I think we did a referral earlier last year, which was accepted. So this is just an extension so we can execute and get these contracts finalized.
I yield the floor.
Any other questions or comments? All those in favor, please signify by saying aye. Aye. And opposed, the same. Carried.
Referral 22-0251, amend Resolution 93 of 2021 as amended by Resolutions 4 and 104 of 2022 to accept additional funding from the United States Department of the Treasury for the Emergency Rental Assistance Program, Monroe County Eviction Prevention Pilot Initiative 2.0.
A motion by legislator Smith, seconded by legislator Dondorfer. Are there comments or questions on this item? Hearing and seeing none, all those in favor, please signify by saying aye. Aye. And opposed, the same. Carried. And are there any other matters of importance to come before this group? Seeing none, with that, we will adjourn this meeting, and the next meeting will be July 26th. It's the next date. Well, I know it's August. We will adjourn this committee, and the next meeting will be August 23rd. Thank you very much.